Hello, my name is Elliot Reed. I'm an osteopath and I'm a counsellor at the Institute of Osteopathy, and I've been asked to explain today what is an osteopath. An osteopath is a guide. It's someone who understands exactly where you are at point A, where you want to be in point B, and comes up with a strategic plan to get you there within the context of pain. So, I'll give you an example. Imagine someone has a lumbar radiculopathy, which is nerve pain from the nerve stemming from the lower back. Now, if we were to be very reductionist with the approach to treating this, we would just provide pain relief to that area. So we would be, as a health professional, be looking to get neuropathic medication, some painkillers, advise rest and wait. What we do as osteopaths is we understand, okay, this is where you are. You have pain going down the back of your leg, you have pain in your lower back, and this is where you want to be, which could be playing golf again, picking up your kids. First off, how do we get you as comfortable as possible, if that's your goal? How do we advise you on how you can manipulate your environment and how you can manipulate yourself to self-treat to reduce your pain? Secondly, as you start to recover, how do we get you back to what you've lost, or even further than what you've lost? It could be that you've lost a certain amount of muscle mass in your leg, or you've lost coordination, you've lost strength. All of these things are needed to get you back into living the life that you want to live. So we provide mobility exercises for pain relief, strengthening exercises to increase pain. We educate you on what's happening in your body so you're as controlled as, or you're in as much control as possible throughout your recovery. But as well as this, we use our hands. So we use manipulation or massage, articulation to reduce your pain. And it's an accumulation of strategy, understanding where you want to be, tactics, this is what we're going to do to get you there, but as well as that, symptom modification the whole way. So this is a much more holistic way of looking at things. We like to think as osteopaths this is a much more effective way to provide healthcare. I'll give you another example. Imagine someone with diabetes. Yes, you can medicate the diabetes with metformin to improve their ability to get sugar to go back into their liver and to their muscle cells. But what about if we were to look at the environment that the person is in? Could they improve their diet? Could they reduce their stress? Could they be better empowered, find knowledge on what they should be eating? Can we navigate them on a journey towards improving their habits, etc.? This comes from one of the principles that the person is a unity of mind, body and spirit, very similar to, I say, our biopsychosocial model that we've got today. We also use a principle of the body has its own medicine chest, so the body within an environment should be able to make a good recovery. Now that we're bringing psychology more into our remit, we also know that defense mechanisms or that person's psychological well-being isn't necessarily going to get better even in the right environment, so we need more psychological modalities to guide people out of that. But our principles are still active 150 years later. It's just that we're now modifying them to make sure that we're able to get our patients in the modern world back to being where they want to be. So in short, just to summarize, an osteopath is a teacher, it's a strategist, understanding where the patient is and where they want to be, bridging the gap in between. And we also use our hands-on skills for assessment and pain relief. I hope that answers your question as to what an osteopath is. If you need any more information, then all you need to do is go to the IOS, Institute of Osteopathy website, and their Instagram page, and obviously you can catch me on Instagram or Facebook as well. Thanks for watching.